cases in China, which then have spread throughout the world. In terms of controlling it, personal efforts are very helpful. It spreads rapidly through respiratory droplets primarily. It does attach to both respiratory and GI tract cells, although the GI contact we think is minimal in terms of passing the infection. So it's very susceptible to topical microbiocidals, bleach and alcohol-based primarily. So good hand washing with alcohol-based preps or 20 seconds with soap and water is effective. And in your home, you know, for those, and you can pass this along, that can't find the cleaners they want in the stores at this point because people are buying up as fast as they can put it on the shelves. You can do a 1 to 10 solution or a little stronger with bleach. That will kill this virus. Or rubbing alcohol will also work. Drinking alcohol, unfortunately, does not work. It might allay some of your fears, but it won't work to kill this virus. It's not strong enough. The virus has an incubation period of 14 days, and really the shedding seems to be higher in the early days before people even know they have it, which is one of the reasons it spreads so effectively, is by the time people have symptoms, they've exposed multiple other individuals to this infection. So social distancing becomes really important. And even if you have a case in your family, distancing within your own home, trying to keep that family member isolated, because some of the most rapid spread was within families in China, and the family that so many people heard about in New Jersey is a similar case. So if a family member is exposed, isolate them. You know, certainly keeping in touch via remote access, as you're doing now, Allison, is really ideal. And we want to do that distancing to flatten the curve. And are all of you comfortable with the idea of flattening the curve, or would you like me to go over the thoughts behind that?
I have a feeling that our group here is very educated and up to speed. If someone feels like we need to go over that, please speak.
Okay, so our most at risk individuals are, of course, the over 60-year-olds, but anybody with cardiopulmonary disease, hypertension, diabetes, cancer, or any immunocompromise. So those can be people with rheumatoid arthritis or even ulcerative colitis, some of the autoimmune diseases that are on immunosuppression. The mortality in the 50 to 59 age group was 1.3%. In the 60 to 69 age group, 3.6, 70 to 79, 8%, and above 80, 14.8% mortality. So again, not taking into account other compromising situations, we've got a lot of folks at risk in this community. Now, so far, I did check the stats before I came online. We're still at 24 cases in Monterey County. I expect that to update. But one of the interesting things was, in preparing to talk to you folks today, I followed over the past week the numbers in California, and it was pretty much holding steady at the low 400s daily new cases, and today jumped above 900. Now, I think part of that is that we weren't testing rapidly enough. We've had limited tests, and as I speak to you, we've got a problem with supplies at UCSF and at the VA with the nasopharyngeal swabs. Now, I'll check with my crew today at the end of the day, but we've got this, we're running short on swabs to do the test. The US supposedly has a stash of these that they're supposed to distribute throughout the country, and the federal government does. Who knew, right? But so more to come on that. So keeping up our testing becomes really critical in terms of being able to help folks isolate and protect their family members and loved ones as this continues to advance. I think it's unrealistic to expect us to be back to usual on Easter in 2 weeks when we just passed China on the number of cases. And as you probably all know, New York is #1 in the number of cases in the US. As of this afternoon, New York had, I think, the US overall had 10,000 or 1,080 deaths as of today, and New York had, I think, 912. So New York is #1. California's #3 behind New Jersey. And with our population, we've got one of the most populous states, if not the most populous. So we're in for a ride. The social distancing is going to be critical in terms of not only preventing spread, but not overwhelming the medical community, because none of us want to be making choices in the medical community on who gets care and who doesn't. And the problem is we don't have a lot of excess capacity in this country. I mean, those ICU beds are already filled with folks with cardiac disease and infections. Those ventilators are in use. Stopping the elective surgeries was a critical action because there are ventilators in surgery that get used. Those are now available for patients. So the other thing it allowed us to do in the medical community was close those wards to well patients recovering postoperatively and use them as isolated wards for COVID. So we don't mix COVID patients with, or even COVID wards with patients with other medical conditions. It does, however, also mean that visitors are limited in any hospital at the moment, just as they are in nursing homes. And so keeping that support, if you know friends or neighbors who are hospitalized virtually, and helping them keep their spirits up when family can't be with them is a critical thing. UCSF is actually coming up with a program. They have a chaplain on board. They are working with comforting the patients without their families there and really giving extra support. But in terms of what can we do to comfort ourselves in the middle of this, well, I think knowing that we're doing the right thing, if we all get through this and we don't know anybody who had COVID or know very few people, then we were successful. And some folks are going to look at that and think that that meant that we didn't need to do all this, but what it really meant was that we successfully did all this and that we didn't have to watch the people we care about struggle with this. There is something called herd immunity, but it involves at least 50% of the population being infected and immune. And we're not going to get to that soon. And we are probably looking at early 2021 by everybody's estimates before we'll have a vaccine ready. And that's because there are all kinds of safety studies and things that need to be done in order to get a vaccine online. And when they tried that with SARS, they found that they actually had a higher death rate in the vaccinated population because they had a much more brisk immune response. So vaccines are in the future, but they're not right now. And we don't know if COVID is a one and done and it'll go through the population, or it's going to be part of our life in the future like influenza is. So there's so many people working on that in so many centers internationally. So again, we're so early in this crisis that there's a lot more to be done. The hydroxychloroquine claims that you're hearing about came from a study of 20 patients in France, and it wasn't randomized, it wasn't controlled. 6 of them got hydroxychloroquine as well as azithromycin, which is an antibiotic, not an antiviral. And that group did better, but it was only 6 people. So you can't extrapolate to to a population from a study that's not controlled and with that few people. So putting that out there in the public domain is practicing medicine without a license. I'm just going to say it for what it is. And one of the comments from the researchers at UCSF, one of her biggest fears, because at the end of a 2-hour grand rounds, they went around and asked all of the top researchers and people who are dealing with the COVID cases there, what was their biggest concern. And one was that things will be flung out there and tried that aren't safe. And we will see more deaths and harm. There've already been 1 death and 1 hospitalization in Colorado for a couple that saw hydroxychloroquine was on their fish tank cleaners and decided it was a good idea to take it. You know, folks are scared, and if you throw something out there, they're going to grab it. So I think we need to be very careful as a medical community and as politicians what we put out there. So in terms of self-help in this, keeping those things like this going, Allison, are great because it gives people forum to talk about things and weigh in. Steve and I have done some virtual dinners or cocktail hours with or without alcohol that have been really quite fun. And we did one with Robin and Dan that was a gas, and Nathaniel. Just reading, doing things that give you joy, getting outside, keeping that 6-foot distance, but and making new goals for yourself, whether they're just household goals or reading goals. I'm a knitter, so I joined a knit along and knitted a sweater in 2 weeks. I have never knit a sweater in 2 weeks, but and as someone said to me the other day, so I asked my daughter, what can I knit for you? Because I just can't knit for myself. And she said, she's an entertainer and she does pole dancing to stay in shape. So she asked me to knit her leg warmers. And one of my friends said, do you feel like you need to go to parenting classes again because you're knitting pole dancing leg warmers for your daughter? And I went, maybe I do. But you know, just finding joy and laughter. I think watching television, things that are positive, reading more positive novels. Laugh therapy has been shown to be helpful in any situation, and I'm a big fan of that. So questions, concerns?
John, do you want to ask the question you wrote?
Yes, Allison. Yes, a question for Dr. Roberts. Thank you for coming to our community campfire. I just have a question. Why does the CDC not recommend that people who are well wear face masks to protect themselves from the COVID-19?
Well, face masks are helpful in preventing spread from someone who has it to someone who doesn't, but we have a shortage of face masks.
Mm-hmm.
And so if everybody is out there using face masks, we will not have the masks we need for the medical personnel that are actually in direct contact with these patients. And so there can be a face mask shortage. We didn't ramp up in anticipation of this. You can, you know, obviously folks who are concerned about who are immunocompromised and at higher risk, it's still a good idea, I think. My brother-in-law, who is undergoing chemotherapy, wears a face mask because he is in the very, very high risk group. And his chance of survival would be very low should he get COVID. But the real issue is supply and demand and who needs them. And right now, our folks on the front line need to protect themselves or they won't be on the front line and they won't be there for us if we need them.
Okay, yes, thank you so much. How about like if we make our own face mask?
Absolutely. And you know what? If you go on Joanne Fabrics, they have an online video that shows you how to make your own face mask.
Great.
And they will send you a kit.
Oh, that's good. Yeah. So, yeah, because I believe that face mask would probably help, like, you know, curve the curve. Because if you look at the which have flat curves right now, they are countries where mask wearing is extremely normal, and not even wearing a mask in places like public transport would be considered antisocial.
Well, and there's also the thing that they did more aggressive testing and they did more aggressive isolation. So it's hard to sort out the face mask issue in that setting just because of those other things. And they, like South Korea, did very aggressive case finding and follow up on all the exposures, as well as very aggressive isolation, as did Wuhan, when they realized what was going on. But yeah, go on Joann Fabrics. They'll show you how to make them, and you can actually have them send you the supplies.
It's like
Okay, thank you so much.
Yeah.
Wayne, go ahead.
Okay. Hi, doctor. I have 2 questions. I heard that 4 teaspoons of bleach per quart of water would be good for a disinfectant, but you had said 1 part per 10 parts.
Correct. And that came from Johns Hopkins recommendations on what it would take to kill the virus from a virologist. So that would be what I would follow.
Okay. And also, can vinegar be used as a disinfectant?
No,
Okay.
it has been shown to be effective. Rubbing alcohol can be used.
Okay. Thank you very much.
You're welcome.
Anybody else have questions, comments? It's not very often you get Dr. Mary at your disposal.
Can I
Okay.
ask a question?
Yes.
Are the Clorox wipes, are they actually strong enough then to disinfect?
Yes.
Okay. And the Lysol wipes as well?
I'd have to look at the Lysol, but what they said were all the disinfectant wipes seem to be virucidal, that this virus is susceptible to the cleaning wipes, both Clorox, and they didn't mention Lysol, but if it's over, I'd have to look at the label, but they didn't single that out as a problem. They said the cleaning wipes were pretty much across the board effective.
Thank you.
Mm-hmm.
Okay. Go ahead.
Hi, this is Elizabeth. I have a question, Doctor. Are you
Uh-huh.
there?
Yes.
Well, this is kind of on behalf of my nephew who lives in England, and he works in the mental health division of the National Health Service.
Mhm.
And he's a young man, he's 25, but he has asthma. And he just heard that he's going to be assigned to go and visit people in their homes in London who are having major mental health issues because of the isolation and the shelter in place. And so what would you recommend that I tell him to do to protect himself?
So I would say he should, definitely have the alcohol-based hand wash with him. And the good news is he won't, if he keeps the 6-foot distance,
Mhm.
if he washes before and after, doesn't touch his face, because he's asthmatic, it wouldn't be unreasonable for him to wear a mask when we're talking about the folks at risk protecting themselves, and just introduce himself and say, I have a medical condition, I'm wearing this for my protection, but do all of the other measures as well. Now, the distancing of 6 feet should be enough, but you're in a closed setting and you're sitting in their home, and so the hand washing becomes critical and not touching your face.
I see. All right, thank you.
Before, after,
Mm,
yes.
good, thanks.
And it wouldn't be unreasonable to have him wipe down his steering wheel.
Ah, good point. All right.
Yeah.
Thanks.
Hi, I'm Kim Hansen.
Hello.
Hi. Thanks again for talking us through all the details. And I actually went to Russo's produce, and I really recommend. The vegetables are beautiful. But I was wondering, when I brought the box in, I mean, my new strategy is to go through the garage. Anything I leave on my garage, I have a table in the garage, and then I've been taking off my shoes, changing, you know, I wear like an outer, like a hat and like jacket. And so I leave all my outer clothes in the garage. And then I was bringing individual things, you know, and I bought some milk, and I was like, and I did make a 10% bleach solution. And so like I squirted, it was a plastic gallon of milk. So I was just like squirting the milk, and then, you know, that the container of it. And I just let it sit there for a little while, and then I kind of like soaked it up.
Yeah.
I was just wondering, is that going, like my husband said to me, I'm going to need a psychiatrist soon. You know what I mean? But I heard that was important to take precautions about bringing things like on your shoes, like leave your street shoes outside and don't, you know, have your slippers or house shoes inside. So I was just wondering, am I being too preoccupied?
Is it extreme? You know, I think it's more than most people are doing, but is it a good idea? I don't think it's a bad idea. I think that in these times, being ultra cautious is not a bad thing. I will say I plan on going back to work, and I will be back in, I'm not sure whether they'll have me working from home in another week and a half or going into work. But if I go into work, I'm not bringing the clothes I wear at work into the home.
Yeah. Okay.
And I, you know, because I can't risk bringing it back to my family, right? And I'll be taking all the precautions in the workplace. But I think most important of all the things you're doing is that hand washing before you eat, or prepare food, or, you know, and after you exchange money with people.
Yeah.
You know, keep in mind, I put some cleaner in the car. Just, I haven't been able to go out and do the shopping. My husband has had to do all of it in the midst of this. So I put it in the car for him and said, when you come back to the car from the store and you've been handling and exchanging money, I want you washing your hands before you know, even take off.
Thank you so much. Yeah.
Mm-hmm.
Alexander, can I talk?
Go ahead.
Oh, Allison, I didn't know if I was on or not. Okay, so Mary, I had a question. We did happen to get some of those disposable gloves, and early on, and we do have some masks. And I wanted to know, is there a way to wash the disposable gloves, or do you really only use them once? Can we do something?
Well,
and also, I heard about the Stanford study about putting the masks on very, very low heat in the oven for half an hour, and it would sterilize it. So I just wanted to get your take on those two things.
I haven't heard the oven thing. I know they're using UV light in some hospitals to be able to reuse their masks. The good thing about this virus, I mean, there are many bad things, but the good thing is it's very susceptible to being killed. And so that's why all of these measures really do work. So I would expect heat to work. And if you want to wash your gloves with the alcohol wash, I mean, it would work on your gloves as well as it would work on your hands.
Okay.
Now, your gloves may break down over time, you know, because they are disposable, but, you know, that will work as well as washing your hands with that wash. Yeah.
Okay. Thank you.
Uh-huh. Don't put the gloves in the oven.
I try to figure out, when you come back from work and you're changing your clothes, you don't have a garage, what's that going to look like if you're going in the front?
Oh, well, I jokingly said I'm going to post a schedule on when I'm changing my clothes to protect my neighbors so I don't have to watch. It's not going to be pretty, but yeah, I'll leave them on the back porch. I'll bring them in, and wash them, and but I'm not walking in the house with them, other than straight to the washing machine. I'll probably hopefully have a robe lady waiting for me out there.
Oh, it's going to be like Sweden around here.
So Mary, can you tell us like when someone should go to the hospital? We actually have a resident that has been sick, and she was very concerned, and they went to the hospital and they kicked her out, and she ended up going to her doctor, who actually tested her for everything else imaginable. Apparently she did get a diagnosis of SARS, or the swine flu.
Swine flu, yeah.
When should someone go to the hospital?
Well, I would say if you're short of breath, definitely. That is the big one. If you're running a high fever and short of breath, but only 30% of people will present like that. And keep that in mind of the folks who develop more severe illness. So it takes a while to develop. Our protocol right now is to test for influenza first, because it is still flu season, and we still are seeing a lot of influenza, which makes this all even more confusing. And if they're negative and they look ill, then we do the COVID test. So that, if they have rapid flu at your doctor's office, you call ahead to your doctor, get their advice. That is one thing you can do, and they can direct you. Can we handle this here? Should you go to the emergency room? Certainly for mild cold symptoms, no, but you should isolate yourself, and you should wear a mask. I mean, the masks are more protective from folks who are infected spreading to other folks than they are for your protection. Because there are a lot of other ways we get this virus, mainly touching things and then not having washed and touching our face or our mouth. So I hope that's helpful. If they're just mild symptoms, isolate and deal with them at home. If it becomes more, because 80% of people will have mild cases. I mean, 70 to 80% of these present like colds and flu. And they clear, and your immune system clears them. Of course, with any of these other problems, that complicates things. So the caveat is, if you have severe cardiovascular disease or pulmonary disease, or you are immunocompromised, then you are the person who should seek care earlier. Does that make sense?
And then I also had a question from somebody who wasn't able to join us tonight, but she was very concerned about the Easter timeline. Can you talk about, I don't know, is there a reasonable time frame we should be looking at, or is it we just have no idea?
We're probably, in China, they're just coming out of it now, and they started in December. So that's a 3-month timeline. I think looking at other countries and what they've gone through, that's our most reasonable guess. And seeing as how we've just topped China in numbers, I'd say we are realistically looking at 3 months. Unless, we do things differently, which is what we're trying to do. But still, we have some states who think this is a hoax, and folks who think it's a hoax and aren't isolating.
Thank you. Sorry, Stephen.
Hi, Dr. Roberts. Thank you for joining us. I really appreciate it. I was just wondering, and maybe it's too soon to know, but if you did contract it and you recovered, are you then no longer susceptible to catching it again? Is it too soon to know? The second part, I guess, of that question is when you track online, the number of people that they say are recovered versus the ones that have contracted it already, it looks like it's taking some time before you see the recovered numbers go up. And I don't know what that means by recovered, actually. What does that mean?
Well, it means that you have antibodies to the virus and you are not shedding. So that's what recovery looks like. And so far, you know, again, we have to look to China and South Korea as our examples, but we're not seeing people relapse. I mean, when people are very ill, there is a phenomenon where they look like they're getting better and then they take a nosedive. And we do see that. That's not a relapse. They haven't come through it, right? But it looks like there is sustained immunity in China and South Korea. And there is talk of, can you use the antibodies from folks who've recovered to treat the folks who are critically ill and help them clear the virus? And we don't know that yet, but there are studies that are starting to take place on doing that. So yes, and there is talk just in the last 2 days, when we look at getting the economy going again, ideally, if we expanded testing and we knew who is immune, those would be our folks who would go back to work, right? Because they wouldn't be at risk and they could get the economic engine going again. But you know, one of the comments was, well, if it was up to doctors, they'd have everybody stay home forever. Well, yeah, we actually take an oath to protect life, not the economy. And so that is our job. But I appreciate what this economic downturn is doing to everyone, you know, and we want to get out of it as soon as it's safe to get out. So that would mean testing and getting the folks who are immune back to work.
Thank you.
Mm-hmm. Other questions? Good questions, you guys. This is really complex.
Dr.
Kim?
Roberts, I have a question too.
Yes.
Oh, I'm sorry, Kim.
No, go ahead.
Go ahead.
So I've heard that if you were tested and you tested negative, that there could be a short period of time later that you could be tested positive because you weren't systematic or symptomatic, or it's a different stage of when it's telling as far as when you have the virus versus at a designated time later. Is that factual?
Yes, it is. And there is the virus is picking up positive 75% of the time. So 25% of the time, it's not picking it up. So you may need to be tested again if symptoms persist. And they are working on more reliable, accurate tests. The COVID test right now is dependent on picking it up from the nasal pharynx. And here's an interesting phenomenon, which I mentioned earlier, but that plays into this, is that the virus is shed more, there's a higher viral load in shedding early on in the course of the disease. So we see some of the largest viral loads in folks who are with very early symptoms. So there are instances where we need to repeat the test if it still looks like COVID, and we treat it in those cases like COVID and support the patient. We don't pay attention to a negative test.
But does that mean that if you have an antibody to the virus, that you won't get it at all, or just not during this season?
If you have antibodies to the virus, it means you had it. That's the only way you're going to have antibodies. And you may have thought it was mild cold symptoms, but you're not going to have antibodies. And we're testing for two different things. When we do the nasal swab, we are testing for the actual virus. When we do the antibody screen, we are testing for immunity. So if you test positive for the virus, you know, there are two different tests. One is for immunity, and that's how they decide you've recovered and cleared it. And then there's one for the virus.
Okay, thank you.
So it would be good to know that you have the virus even in the early stages, because then we could chart recovery for folks and get them back to work.
But if they're not doing, unless you have high symptoms or very obvious symptoms, it doesn't sound like they're testing you for anything.
Oh,
or
and that's the problem. I mean, I was looking at California's numbers daily. We were at 400 until today. We jumped to 900 new cases. We were averaging about 400 to 430 new cases a day in California. We jumped to 918 earlier today, and we're not done with the day. And I think all along as I've followed the numbers, my concern was, is it really that low, or are we just not testing enough? And I think as the tests have come online, we're going to see the numbers go up, partially because we're testing more and partially because the cases are going up. And it's hard to sort out those two right now. But if you test positive for the virus, and we can get more extensive testing out there so anybody who wants it can get it, which is what they had in South Korea. They tested 5,000 people per million population. That's really high testing. We're pretty low on that standard right now, but picking up.
okay, thank you.
Mm-hmm.
Dr. Roberts, thanks again for spending your time with us. I appreciate it. I want to go back to that question about the antibody test. I'm wondering if that's an easier test to perform than the test for the virus. And if it's an easier test, is that something that is, we should think about doing more often, just to see if people have had it and now have the antibodies and are free to walk around in public?
Well, yes, but the system is overwhelmed right now just trying to get the testing done. I think that's where some preparation for this would have come in, would have been really helpful. But right now we're just trying to catch the folks who need medical care. But down the line, we will be doing more of that, I'm sure. It's just, or if you test positive and then you recover, we can assume you have antibodies, so we don't need to test you. It would be testing the asymptomatic folks or the folks who had early, that's where it would be helpful.
Yeah. How long in the recovery stage do you have to be before you have an antibody load that you can easily detect?
About a week to 2 weeks.
Okay. And is that a blood draw?
Yeah.
So that's not as easy, obviously, as doing a swab.
I don't see anybody doing that right now. It's all worried about getting the testing done for the folks who are ill. And as I said, if you tested positive for COVID and you recovered, then we would know you had antibodies, and we could, and they are looking at that recovery phase now in other countries. We're too early. We're about a week. I mean, really in timelines, we're about a week behind Italy. So we haven't seen the worst of this yet.
Yeah. Okay. Thank you.
Any more questions?
Steve, go ahead.
Hi, I'm sorry, I have one more question. Since you mentioned that California's numbers have gone up and likely due to more testing, is there any thought on Monterey County specifically and our numbers? Because from what I've seen from just trying to track it as much as possible day to day, they don't seem to be moving too much, which is kind of comforting. Maybe that's because our local officials and at the state level too jumped on this quickly, thank heavens. But I was just wondering what your thoughts are on the Monterey County numbers.
I actually looked at this last night, and I would agree with you. I think we're doing well. We've tested, as of yesterday, I think we had tested 384 people in Monterey County, which is a county of 28,000 some folks. And so actually that's not a bad test rate. And we are staying pretty low. We are seeing some new cases every day, but not a lot. And I think it is because we implemented measures early on. And we hopefully will see that we stay in that low level where there's a few cases every day, but not a big jump. The numbers that went up for California are probably out of San Francisco and the Bay Area, which is there, and they're beginning to see things level off, but and they just started testing more robustly. So far,
Yes,
so good
thank
in
you.
Monterey County.
Yes, doctor, I have a question.
Uh-huh.
And my question is if there's a need, you fall off your bike, have a broken leg or something like that, and you need obviously to seek medical help, the hospital is still open for that?
Absolutely. And that is why all elective surgery was discontinued, so we can deal with the emergent issues as well as COVID. And that's happened all over the country. So yes, emergencies, you have a heart attack, you still go to the hospital. You have pneumonia that's not COVID, you still go to the hospital. So the hospitals are trying to stay open for all of the emergencies, COVID and otherwise. And they have isolation wards for COVID patients, so they aren't mixed in with the other patients.
Okay, thank you very much.
You're welcome.
So Dawn, do you have any questions? How about Gary? Gary, do you have any questions?
No, it's been very informative. Thank you very much, doctor, for coming.
Oh, you're welcome. Keeping up on this has been part of every part of my day because I'm going to jump right back into it in about a week and a half. And I want to go in and be as helpful to my crew as I can. But, you know, we're all about trying to save people. And this is a situation where we can really help save our neighbors and ourselves. And I really congratulate everybody on doing this so successfully so far. And again, want to stress that if you don't know anybody who's had it and we get through this and you don't know anyone who lost their life to this and haven't heard of anyone, then it wasn't because this was for naught, it was because we were successful. And I think Italy, Spain, New York, we can all take a lesson from that. This is no hoax.
Wayne?
Hi, thanks again, doctor. Do you think it's advisable to get a pneumonia 23 vaccination?
Always.
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 So
Always.
it's worth it to go into CVS and get the inoculation.
Yeah, ideally you'd get it before we were at this point, but because we don't want you exposed. But yes, I'm a big fan of pneumovax. It's been shown to save lives. And one of the things about COVID is it causes its own pneumonia, but one of the complications are the secondary infections we see when lungs are already compromised with bacterial pathogens as well. So yes.
All right, thank you.
Uh-huh.
Scott and Terry, do you have any questions?
Well, we're good. We appreciate the information
Yeah, it was
and the
great.
questions.
Great. Dino, do you have any questions of Mary?
I don't. Thank you very much. Very informative.
Okay. So I always have one more. What is the treatment? So, you know, if they go into the hospital, what is the treatment?
Well, right now it's really supportive care because there have been some trials of using prednisone, which has been shown to be helpful in some situations with adult, what we call ARDS, adult respiratory distress syndrome, but it's not being shown to be helpful with this. So it's really supportive care, keeping folks hydrated, ventilating them or on high flow oxygen has been shown to be helpful before, you know, and hopefully they won't need a ventilator. And one of the complications we see in the more complex patients is they go into multi-organ system failure, so kidney failure and liver failure. And so it's supporting people through all that and hope that we can get them through.
And can you also talk about, I'm starting to see things about ibuprofen and are they SAIDs and how you shouldn't take them?
I looked at that who couldn't take ibuprofen. There was, actually that was addressed in one of the grand rounds, and they said there was no data out there supporting that. Having said that, if you're stressed, ibuprofen and any of the other anti-inflammatories in that class can cause ulcers. If you have kidney compromise, it can compromise kidneys. Tylenol is always your safer bet for many reasons, but nothing so far in the literature I've read. I mean, they did talk about that and said, we just don't have any data supporting that.
Thank you. All right, guys, it's about 5 till 6. Any last questions, comments?
I do have one. I would like to ask one more. Thank you for that on the ibuprofen. I had heard that as well. Should you get symptoms and you're in isolation, can you tell us what types of medications to take? I mean, are you taking Mucinex, DM? Are you taking what kind of meds to get you through that period of time of discomfort?
So one of the early symptoms can be GI. You can have a little bit of diarrhea. So obviously staying hydrated and using even sports drinks like Gatorade or Propel that give you a little bit of sodium and potassium. In terms of the respiratory symptoms, just anything you could take for the common cold, you could take for this. So whether you want to take Mucinex or Robitussin or NyQuil, any of those would be safe. Tylenol for, if you run much of a fever, that's when you should go get tested. But if you're not running a fever and it's just mild cold symptoms, you can treat it like any mild cold. And coronaviruses typically cause no disease or do cause mild cold symptoms, and they have been around for a long time. But when they jump species, this tends to be where they mutate and become very virulent, which is the case for this one.
Thank you so much.
Mm-hmm.
Anyone else? You don't have to raise your hand, just talk. All right.
I have one last sort of a broader question. So if people are keeping control and keeping themselves safe and they're okay, what can we do to push out into the community to help the next level out from us?
You mean, what can you do to help the folks who are suffering from COVID, or?
I guess it's either the people who are on the front lines, or who can we pressure in the government to say, okay, this is there? What do you in the public health zone? What's the next level there is out there?
Well, I'd say there are a lot of people at risk for.
Deliver them drinks.
This is non-alcoholic, by the way, but it's good. There are, I would say, the folks who are in the hospital, the folks on the front line, the best thing we can do is shelter in place and keep ourselves off that front line. And in terms of our communities, there's a lot of kids going hungry that we're getting school meals. There are elderly folks, so Meals on Wheels is still delivering. If you can see if you can help at all in some of those efforts, either financially or, support-wise, or dropping off meals on people's doorsteps, that kind of thing. There are a lot of folks who are out of work, so the food banks are a possibility, or even whether it's monetary or just buying a few extra things if you find them and dropping them at your local food bank. I think, you know, the folks on the front line just staying out of their, not being one of their patients is the best thing we can do. But we have so many other people in our community that are at risk for hunger and shelter. One of our biggest concerns in medicine is how this spreads through a homeless population. So I know there are efforts underway to house the homeless, and, you know, see what your community might be doing about that. And I know it's hard to know what to do in this setting, but those are some ideas that are out there. And yeah, and, you know, not to plug a specific political agenda, but Bernie Sanders his group has 5 organizations they recommend contributing to that's dealing with these issues. So that is a resource.
I would definitely suggest donating local. I know that our local Meals on Wheels are in need of drivers. The food banks need money. You know, perhaps as a community we could come together as a food drive, and, you know, just put all your food in the back of a truck and we go deliver it or something. But there's plenty of local organizations. I don't know Bernie's organizations, but please.
Oh, actually, there are organizations that are donating to kids' meals in schools. And so it does go. I mean, I think if you can't figure it out, that's one place you can go that's national. But I agree, you know, that's why I mentioned Meals on Wheels in your local. I know a lot, they're doing food deliveries to some of the school children that we're getting free meals, and figuring out who's doing that in our district.
I tried to volunteer to give those meals to students, and they said, which is really nice, they said the kids are totally enjoying getting their food from their teachers and their principals. So they had plenty of help, and they didn't need me, at least this week. So yeah, so that's great. You have a question?
Yeah.
Oh, sorry. Jerry's here. He has a question.
Hi, Mary.
Hey, Jerry.
I'm sorry, I got here late. This may have already been asked, but I've heard or read that asymptomatic people who have asymptomatic are the highest spreaders of COVID.
Yep, you're right. And I had brought that up in my initial presentation, and that's kind of surprising, but it does say why that 6-foot distance and the good hand washing and wiping things down is so important, because the folks who are spreading it don't know they're spreading it.
Right.
They may have the symptoms. Yeah.
Good. Well, good to see you, Mary.
Good to see you, Jerry. I won't see you in the office in a while if you're lucky.
Yeah.
I can say that because you got outed right up front, and so did I. So.
Yeah.
Oh, okay. The secret is out. Well, I'm lucky. I gotta tell folks that in my recent physical, which I have twice a year, with whom I think is the best doctor I've ever had, she was checking my breathing, and she said the word breathe in, and I did, and then she started going on and doing other things, and I just held my breath because I follow the doctor. Well, last minute she saw me turning blue. I still get a kick out of that. Anyway, thank you.
I forgot to tell him to breathe out.
I've been breathing out ever since.
Yeah, I love it when people always go, should I breathe? And I go, always. Always.
Hi, Karen.
Hi, Allison. Hi, everybody.
So
hey,
Karen, we're actually getting ready to wrap up.
Oh.
But do you have a
Johnny on the spot? That's me.
Do you happen to have a question? And I know you had a question the other night in particular to do with Dirk. Mary's still here. If you'd like to ask that or any other question, now's the time.
Well, my husband's at a care facility up in the Bay Area, and they've been FaceTiming. I had a nice FaceTime this morning, which was great, but I'm just fearful what's going to happen when he gets at the facility. And in hospital, you know, are they going to be able to take him, you know, if he were to come down sick?
Well, that is why I would presume his care facility is not allowing any guests in. Is that right?
That's correct.
And that is why, because we're trying to protect those folks in care facilities. Because if it does get in, everyone in there is compromised by definition. And again, as long as we don't overwhelm the hospitals and we all do our distancing, that allows them the bandwidth to take care of those folks if that happened. That's, you know, as you know, that was the outbreak in Washington State, and they didn't catch it or didn't realize what was going on. But we've learned lessons from that, and that social distancing becomes critical for those care facilities. No visitors, all virtual contact, which makes it hard on families, but in the long run, hopefully safer for our loved ones. So if we continue to flatten the curve, the idea is we can take care of all those folks that come in if that happens. I know that's probably not as comforting as I wish it was, but it's, you know, we all need to do our best. And what you missed that I said earlier is that if we all get through this and don't know someone who had COVID or don't know someone who lost their life to COVID, then we did this successfully. And it may look like we didn't need to do it, but that's not the case. And we know that from Italy, and we know that from Spain. And if we're successful, we will hopefully know very few people who were very ill from this.
Michael, I just noticed you're up here and you're with us. Do you have any questions?
Hey, thanks, Allison. Yeah, I'm sorry to join late, but you know, I appreciate the dialogue. It so happens that I'm actually sending a note out tomorrow morning to all of my company to just sort of a regular communication. And I think you know, as I've thought about that and drafted that note, I've thought about, you know, what is it that I, as the head of the company, can do to reassure and you know, in these times. Certainly I'm not going to presume to know anything about what's coming or about the medical aspects. I can certainly talk about what we as a company are doing, and we're doing everything we can to follow the benefits and follow the changing laws in California and the federal laws. But I guess my question to Mary and any of you is, you know, what do you think should go in my note to a company of 100 people, you know, to reassure them that you know, that we're going to make it through this? Thank you.
I would say, you know, encourage them to keep up those social contacts, because it's important for just our camaraderie and mental health in the midst of these changes. That I talked about this earlier. One of the things that is starting to be talked about is testing for immunity. If you do get the COVID virus, if you have immunity, then those are the folks that could get back to work earlier and start gearing things up again. So there's a role for all of us to play. I think supporting each other is the best thing we can do. And I thank Allison for setting up this forum, and just pleased to be able to come and answer questions. But yeah, that this is, all they have to do is look at Italy or Spain and know why we have to do this. And what you missed is we just actually overtook China in the number of cases. So we're number one, not a place the United States wanted to be. And we're still a week behind Italy. So know that there's more to come, and just that social distancing and protecting those we care about.
Thank you, Mary.
Mhm.
I agree. Any other last minute? I'm enjoying this, actually. I feel a little guilty saying that, but I'm enjoying this conversation. All right. Well,
I'm sitting in my house for 2 weeks, recovering from surgery, and actually 3 weeks today. And it's good to feel like I'm doing something besides rehab.
good. Well, can we ask you back in another week? Okay.
You may.
Oh, wonderful. That'd be great. So I just want to say thank you. I have just a couple of local pieces of information for everybody, but before I do that, I just want to say thank you so much to Dr. Mary. Yay. Thank you.
You're welcome.
Thanks.
Yeah, glad.
So before everybody dashes, I just want to let you know a couple of things. I've been getting emails in response to my messages, and one of which was to remind everybody that going out for walks is good and fine. Apparently, there's some concern about the term lockdown and what that means, and some confusion about not going outside. I think those of us on the north side of Delray Oaks are very active. I mean, Portola is just, you know, it's really lovely to watch everybody running and walking their dogs. The other thing is Delray Oaks Nursery is open. They're trying to figure out their online and delivery or drop off, but I don't know about you, but it's springtime, and my mental health is directly related to having my hands in the dirt. So that'll be good. That was it for me. And I'd like, Scott, do you want to take a minute, and do you have something to say?
Sure. I'd just like to share, for those of you that were here last time, I kind of jumped into the idea, oh, this is a mini workshop, and this isn't the place for it. But I want you to know this is very important to me to share ideas and practices about stress resilience. And so I am excited to share the science behind mindfulness. And what I've done is I created my own Zoom account. I upgraded. And so I'm going to be, I'll disseminate that through you, of course, Allison, so that people can join a Zoom where it's about mindfulness, and we can really take a look at that and really have an impact, because it's really is transformational, and it's all evidence-based, and I look forward to sharing that with any of you that would like to join. So I'll get that out soon. I'm thinking Saturday.
Okay.
Yes.
Great. And Don, did you've been pretty quiet. He was out walking. He may have left us. Okay. Any last thoughts before we go off for the evening? Somebody's.
I do have one. I read in a German newspaper, and I confirmed it with my family, that they don't even, let's see, they're ignoring the people 80 and over. They're not trying to give them medicines or anything like that. And it just came out in today's newspaper. And I've heard it before. They very, very little medicines are out there for people over 80. And there would be a lot of people of us falling under that, you know.
Yeah.
They're having to decide on the younger versus the older treatment.
No.
Mary, do you have any comment?
Well, in truth, there's not a lot of medicines for this. It's all supportive care at this point. And so I have not heard any evidence that people over 80 would be denied care. What we have heard, and again, my concern, my marked concern for flattening that curve, is that we don't have to start making choices on who gets a vent and who doesn't.
Right.
There have actually been videos on how to connect 4 patients to 1 ventilator. As crazy as that sounds, I mean, those contingencies are out there. We we don't want to have to choose one patient over the other. We never want to be in that setting. And the choice would be made by, if it ever came to that, on who is going to survive and who isn't, not on age.
Okay, thank you.
Yeah.
All right, guys. It's about 10 after. I want to honor everybody's dinner time and keeping the meetings to an hour. So again, Mary, thank you. And we'll definitely try and have you back sometime pretty soon.
All right. Everybody stay safe, and thanks for inviting me.
All right. All right, you guys have a wonderful evening. And I hope to see you out walking around. Good night.
Night.
Good night.
Bye-bye.
There is.
No, but that was before already.
That was good.
Yeah.
She's good.
Yeah, she is good. Wayne, any questions? No? Oh. All right. Good night.